Welcome back to another episode, all. Throughout this episode, I'm going to be talking about the disability industrial complex and of how it's just the remains of the racist eugenics movement. In the late 19th and early 20th century, during the eugenics movement by Francis Galton, Carl Pearson, and Ronald Fisher, psychiatry and pathology lost scientific credibility and became more based on social policy to produce what they saw as paradise on earth. Anyone who violated the social policies were automatically labelled as disordered like homosexuals were, as the social policy was to be heterosexual. When the eugenics movement was discredited and after the Nazi Holocaust in 1952, they produced the DSM system. In 1952, there were approximately 60 disorders. In today's DSM system, there are approximately 300 disorders. In the second half of the 20th century, intellectually disabled people were still in institutionalization. People took this as the opportunity to produce the intervention industry. Each time they edited the DSM, they have increased how many people are worthy of a diagnosis. In the 1980s, the drug industries joined, and they began selling disorders so they could sell drugs. Dr. Alan Francis says, I quote, "Putting aside all the problems with the DSM-5, the simple fact is that psychiatric diagnosis has become way too loose. Today, 25% of Americans meet the criteria for a diagnosis in any given year. 20% of us take psychotropic medication. That's 1 in 5 people. We now have more deaths in emergency rooms from prescription drugs than from street drugs. Pill popping is rampant, along with all the unnecessary side effects of drugs. The new DSM will just make this worse. The National Institution of Mental Health doesn't even use the DSM system." I'm just going to quote someone called Dr. Bruce Perry from a book. He says, I quote, "The psychiatrist, author, and leading trauma researcher Bruce Perry has come to disdain diagnosis almost completely. This is no knee-jerk prejudice. His dim view of the norms and practices of his field follows decades spent assessing tens of thousands of troubled children, and extensive contributions to the vast literature on adversity and what we define as disorders. When I got into psychiatry, Dr. Perry told me, it became clear really quickly that the diagnoses were not connected to the physiology, that they were just descriptive, and that there were hundreds of physiological roots to somebody having an attention problem, for example. And yet the profession acted as if these descriptive labels were really a thing. I knew that if we were doing research, if we were using these hollow descriptors, which we call diagnoses, and then study interventions and outcomes, we would just get garbage, and that's what we've done." These days, Dr. Perry is adamant that even playing the DSM game is completely wrong. When invited to contribute to one of the manual's editions, he refused. I said, "Listen, in 25 years they are going to look back and won't believe that we thought about people that way. It's not a valid way to think about the complexities of human beings." He practices what he preaches in the clinic he helps run. "We haven't used diagnosis for 15-20 years, he said, and it really has not interfered with our ability to do good clinical work. In fact, we're able to do better clinical work without using those labels." End of quote. It says, "The intervention and drug industries began profiteering on disabled people in general, and these industries, their sustainability was dependent on the diagnosis rates of disorders. So they had to sell disorders to sell interventions and drugs. Like today, if you go to a GP and report anxiety, for example, you'll fit the criteria of an anxiety disorder or a depression disorder and they'll prescribe you pills, just give you drugs or send you to interventions. If you go for an autism assessment, a clinical assessment and something, if you get diagnosed as autistic, they'll automatically recommend you to send your child to applied behaviour analysis, ABA, which is very problematic and controversial. Even though your child may not need these interventions, they'll just send your kid to the intervention. Throughout the rest of the 20th century, psychiatry and pathology took a page out of a capitalist playbook, where they make rhetoric ideology seem like a threat to the economic architecture of our society. When it's seen as a problem, it is only logical to find a solution, and the solution would be to cure and eradicate disabilities, heading back towards the intentions of Galton, Pearson, and Fisher in producing Paradise on Earth. By fear-mongering the general public, they made nearly all disorders in the DSM classified as disorders with a genetic component, but 97% of the disorders in the DSM, there is no genetic component to them. This produced the prevention industries and the genomic research industries. By making all these medical matters, they became worthy to receive medical funding and insurance. The very people who advertise and talk about the cost of having a disabled child are the very people making a profit out of you. If you think of a vending machine, you've got one payer, but when someone's paying, there's always a receiver. So who receives the money? Now that we can diagnose more people, we have the formula of high demand with low supply, which equals high potential for profit. But by there being so few services, but so many people getting diagnosed, they'll go for whoever's willing to pay the most. High potential for profit. As the profits were made by the Behaviour Analyst Certification Board, the leaders of ABA, private equities and other stakeholders gained interest. Charities run campaigns every year as awareness months or days, collecting donations. Businesses can make and sell disability accepting products to profiteer on. Like they might make a jumper or t-shirt with the Neurodiversity logo on. So even though it's supporting neurodiversity, that would be a bit more expensive than a plain t-shirt. So they've just made a profit on clothing. YouTubers, for example, can make channels about disabilities, but rather than doing it for awareness or acceptance, they could always do it for sponsorship and for money instead. So even disabilities in general have become money-making opportunities. And this is the point when the general public enters the industry. As more people are diagnosed as disordered, more people face employment discrimination because of all the stereotypes presented on the mass media, placing them on benefits. As more people receive benefits, the more council taxes will rise and wages will reduce. So non-disabled people benefit from disabled people by having all the opportunities to be part of society, and the disability industries benefit from the general public's taxes. Treating disabled people as commodities and trying to produce paradise on earth is an even bigger financial burden, resulting in poverty and financial crisis. Every April, all the autism industries gather together for an Autism Investor Summit to discuss what are the best business decisions to make the biggest profit. If you type on Google, Autism Investor Summit, you'll find it asking you to register, but you can register to go there. And this is the actual main reason why the anti-neurodiversity crowd pushes against the neurodiversity movement. They often complain about self-diagnosis and call it a social fad. The reason they hate self-diagnosis is because they lose profit when someone diagnoses themselves. A self-diagnosis does not count as medical proof. The only people entitled to services and benefits are those with a clinical diagnosis. So when the anti-neurodiversity crowd say self-diagnosed people take help away from those who need it, they're just lying, because self-diagnosed people are neither entitled to services nor included in the statistical records. The only problem self-diagnosis causes them is a reduction in profitability. The UK's National Health Services are both understaffed and in a financial crisis. If we put more people into the hands of the medical system, they will need more financial support, and that support will come from an increase in your taxes. Psychiatry today is more of a marketing plot than it is a science. Searching for cures, screening, and other irrelevant activities are far more expensive than accommodation and acceptance of disabled people. If psychiatry didn't dehumanise and pathologise us to begin with, your council taxes would possibly be much lower than they are. Please, may you help increase the awareness of the disability industrial complex and spread the message. If you like this video, please hit like, hit subscribe, and you'll know when more content is uploaded. Thank you.